whereas paid witnesses, they will say anything to collect their fee.
A psychiatric expert who will have one opinion in one scenario and a completely opposite opinion in another scenario based on which law firm or governmental agency is paying for his time.
These psychiatrists, on one hand, will tell the public that suicide can be prevented, but will go into court and tell a jury that suicide cannot be prevented. And then once you show his prior inconsistent statements, you also show that he is paid very well by pharmaceuticals, then the jury says, you know what, we're not so sure about you because you just lied to us.
Add to the greed, dishonesty, and avarice their sex crimes. Accounting for only 6% of the physicians in the country, psychiatrists commit 1/3 of the sex-related offenses committed by doctors.
It has happened so often that by the mid-'80s, the insurance companies who insure physicians across America started writing sexual claims out of the policies altogether. That's how common it was.
The system was so broken that more than 25,000 complaints had been registered, but nothing acted upon. When a psychiatrist has a patient, a female patient, and abuses them sexually, there's a very high probability they'll get away with it.
I've seen many cases where the mental health professional becomes very disturbed and is using very strange and odd treatments, and that can go on for many years with no one finding out about it because it's not very public. It's quite private. Things happen behind closed doors.
Tragically, their sex crimes often involve children. Case in point, Dr. C. Markham Berry. On the surface, a well-respected member of his community. But all that shattered when he was arrested on child molestation charges. Van loads of child pornography were removed from his home, and the subsequent investigation uncovered his sexual abuse of former patients, boys aged 7 to 17, who he photographed and sodomized. All part of what the state called 50 years of Berry's rampant, undetected sexual escapades with children. This is not an isolated incident. It is the carefully masked character of the members of this profession. In every city, every state, every country, you'll find psychiatrists committing rape, sexual abuse, murder, and fraud. And as you will see, psychiatry's entire credibility depends on the biggest fraud of all.
I was diagnosed with a chemical imbalance, manic depression.
They diagnosed me with having ADD.
He told me I had conduct disorder,
ADHD,
mild depression,
Major depression,
manic depressive,
borderline personality disorder,
social anxiety,
depression and schizophrenia, depression,
sleep disorder, identity problem disorder.
There's no such thing as mental disorder. A mental disorder is whatever someone says it is, and if the person saying this is a mental disorder has enough power and influence, then people believe, oh, that's a mental disorder.
But you can't have power or influence without credibility, so psychiatry manufactures its own.
It's based on a grab bag of checklists for disorders that are published in a book called the DSM, which is the Diagnostic and Statistical Manual. There are no statistics in this book, by the way. That just makes it sound more scientific.
They create this cluster of disease, and they get together and they vote. Is this a disease? All in favor, say aye.
It's marketed as a scientifically based document. Now, the American Psychiatric Association, which publishes the DSM, do a lot of work to create an aura of scientific precision around the DSM, but it's not scientifically based.
Since the first edition of the DSM, the number of mental disorders voted into psychiatry's diagnostic manual has grown to 374. And with each new disorder, psychiatrists create yet another way to defraud the public.
If you have 27 ways to bill in the DSM, that's 27 ways to bill. If you have 300, that's 300 ways to bill. So you can pretty much find anyone walking on the street that could fit into a DSM somehow.
When you build insurance companies, you can't say the word. You've got to send in a number. And they have numbers for the most ridiculous things, like arguing with your mother or peeing in the bed.
Adolescent rebellion disorder is an official psychiatric diagnosis. Arithmetic learning disorder is an official psychiatric diagnosis. General anxiety disorder is a recent diagnosis.
For each one, there is a 5-digit code with a decimal point. Now, the implication of that is if I have illness 403.16, that's different in some important and scientifically proven way from someone who has 403.17. And nothing could be further from the truth.
Incredibly enough, while presenting the DSM to the world as scientific fact, psychiatrists freely admit its utter lack of science.
We have no diagnostic reliable markers for almost any illness there is in the DSM.
What we're testing for in psychiatry, it's hard to say because there's nothing specifically.
But as far as a test that's clinically useful, basically we're not there yet.
We don't have any laboratory tests that we can use to determine whether somebody does or doesn't have a mental illness.
There are no good biological tests for detecting mental illness.
There is no test, there's no biopsy you can do.
There is no chemical test right now.
There are no specific tests to confirm the diagnosis or show the improvement, like any blood tests or any x-rays or anything like that.
Oh, in my practice I don't do any tests. I just speak with people and listen to them, and then I make a decision in what kind of illness.
These diagnoses vary as widely as the psychiatrists who make them. In this hidden camera footage, a person visited several different psychiatrists, complaining of the same symptoms.
I'm extremely unorganized, and I didn't used to be. It's caused problems in the family. It's caused problems getting, I'm self-employed.
You've got ADD, ADHD, and you're depressed, and your depression is bipolar depressed.
You have a brain chemistry disorder, and it's probably genetic.
You have a lot of the symptoms of depression.
So it seems like it is a mixed picture. What that means is like we got some depressive symptoms and some, high symptoms.
If you're bipolar, I'll need to give you a mood stabilizer. We don't know. I kind of doubt it. It's
considered low-grade bipolar.
You are more of the ADD than ADHD.
And as far as medications for depression, because I would recommend that you start a medication, which are Prozac, Zoloft, Paxil, Celexa.
Usually Propylene XR is pretty good.
They'll give you some Lexapro in the morning and some Trazodone at night.
Lamictal is a better medication for that. It works on your depression also.
But the treatment for any bipolar cycling is the same. The lithium.
Remeron is another one.
Trazodone.
Tegretol.
Depakote.
Wellbutrin.
Lexapro.
Lamictal.
Equitroid.
Depakote.
Lithium.
Ambien.
You may need an antidepressant also with your Lamictal.
We don't know if I give you a medication if it is going to work or not.
To a certain degree, it's trial and error.
You never know if it's the right drug.
How many people have I cured? Well, there are no real cures right now in psychiatry.
I have cured none of my patients.
We're always challenged by our lack of knowledge.
In fact, we don't know what the causes of mental illness are.
Most mental illnesses, we do not know the cause.
Of course, it would be nice to know exact reasons of disorders, but maybe in the future.
I'm the Director of Research at the American Psychiatric Association. We don't know the etiology of really any of the mental disorders at the present time.
DSM-5 is coming out. It's grown to 10 times its original size, and it labels everybody. I could find 5 diagnoses that would fit you or anybody else.
Compare this to the research methods of pathology, a real science that discovers real diseases using a wide variety of precise diagnostic tests.
We do millions of laboratory tests as well as these